Welcome to lesson number 6 of Module 5, Case Study. I'm your host, John Malanka with The Sacred Plant, and today we're speaking firsthand on a case study of traumatic brain injury. For doctors, case studies provide stories of patient care in real time. This is helpful in seeing all the nuances faced when creating the best treatment plan and tracking how they can continue to reach optimal dosage for the best results. It also allows us to understand the varying levels of details we need to be looking at to have the most possible successful outcome. In this case study, Dr. Stein will share a story of treating a TBI patient with medical cannabis. Let's dive in. Dr. Stein, welcome back, and welcome back to the Sacred Plant family and community. Thank you for being here. People always ask, Dr. Stein, do you have any case studies? Do you have any treatments that you can share? We hear all this stuff about science, but, is it really working? And can you share about any case studies? And so I thought that's why we incorporated this lesson just to be devoted towards case studies. Patients that you've seen, that you've worked with over the years, and who've had success and who've not had success. So if you have both, I'd love to hear both, because, cannabis doesn't always work. So love for you to share some of your stories of cannabis and traumatic brain injury, as well as brain disorders. If you can share that with us.
In recent years, I've been seeing a lot of young athletes.
Okay.
Concussion work has been a subspecialty of mine for a while now. And I like to work with the high school student athletes here in Sarasota. And what happens is they graduate and then they go off to college, and sometimes they remain my patients. And I have one case in particular of a young woman, student athlete, who is a goalkeeper. Mm-hmm. And while here in Florida, she suffered a traumatic brain injury when she did a header into the goalpost, trying to make a save. Yeah. She was quite ill after that, for several weeks at least. She developed problems with thinking. She couldn't think clearly. She had problems with balance. She couldn't sleep. She had headache. All the typical signs, all the typical symptoms, I should say, of traumatic brain injury from concussion. When I would examine her, I would look at the eye movements, and I could tell that they were not moving normally, which of course went along with her balance difficulty. I tested her balance by having her stand on one foot with her eyes closed and her hands on her hips. She was not able to do that, and she could do it before. Uh-huh. And so what we did was we had her go for vestibular therapy.
What kind of therapy?
Vestibular.
Okay.
Vestibular therapy is a special type of therapy where patients are tested for balance problems and given tasks to improve their balance abilities, sometimes with a moving screen in front of them. So there's a device that they use where patients will stand on a pressure plate, it's called, and they're in a harness, and there's a big screen in front of them. And the pressure plate underneath their feet measures how much sway they have.
Okay.
And then the screen in front of them gives them a visual challenge. And then you can measure how the person adjusts to that visual challenge. So it's pretty high tech. And it's very helpful for exactly measuring how much balance difficulty someone is having, so that over time you can measure recovery. Now, she recovered.
Okay.
She went off to college, had another concussion playing soccer, and this time did not recover as quickly. And that's the story we hear a lot. Multiple trauma leads to slower recovery.
Okay. And with this case, did you incorporate cannabis? Was she open to this, or was she a collegiate athlete?
Yes, she was a collegiate athlete, and I did incorporate cannabis with her permission, of course, the second time.
Okay.
Not the first. When she came in, the second time she came in with her mom, we talked about how cannabis can help reduce some of her symptoms, which included insomnia and headache, primarily. She had some trouble thinking also, but I was hopeful that if we could improve her sleep, it would improve her ability to think clearly. And we were successful.
Yeah.
We were successful. She wanted to inhale the medicine, so we provided her a medical card, which gave her options, but my guidance went along with her desires. I thought that was fine. So she was using a type 1 THC rich cultivar with a higher amount of myrcene in it, so that at nighttime she could be mildly sedated, sleep, get that restoration, and hopefully help with some of the headaches and trouble thinking.
Mm-hmm.
She had another preparation for daytime use that had a lower amount of THC. It was more of a type 2 preparation, equal amounts, and less myrcene.
Yeah.
So she wouldn't be quite as sedated. It would have more limonene, actually, which would improve her mood. Limonene is a potent antidepressant, and in her, depression was a problem. So we used limonene and 1-to-1 during the day, and we used myrcene with more of a THC predominant strain at night.
Was she a patient that was had potential to have CTE?
Well, I suppose we don't know for sure how many traumatic events it takes to develop CTE, but based on epidemiological studies looking at the population and what happens, it seems to take a lot more than that.
Mm-hmm.
There was a study that Dr. Gesowitz did at the University of North Carolina in Chapel Hill, where NCAA athletes were monitored for cognitive changes over the 4 years that they were in college. And he did careful neuropsychological testing every year, and then correlated that with the number of head injuries they had and how the score changed over time. And he determined that 3 seemed to be the magic number. If you have 3 severe concussions, that's the point after which your neurocognitive function declines significantly, and in some respects does not get back to normal.
Do you present at a lot of conferences, or do you present your findings at a lot of medical schools or medical conferences?
I did present.
Outside of the cannabis industry?
I did present. I presented a concussion study out in Denver. There was an Academy of Neurology meeting there. We had done a study here with student athletes monitoring their balance and cognitive function throughout a season, trying actually to replicate some of what Dr. Gesowitz was doing at UNC Chapel Hill. And I presented a poster there at the conference, and it was very well received.
I bet it would be. You know, this is a topic that is starting to have a buzz around not only the cannabis industry, but the pharmacy, the pharmacist industry, as well as doctors, oncology, pediatrics, and I'm assuming here in neurology as well. So thank you for leading the way for that type of education. So I know we've spoken about cannabis, and cannabis is not a one-size-fits-all, which we've shared numerous times in all of our series. But in the case of your patient, the soccer player, the goalie, you're treating sleep as well as anxiety with her. And then you made a mention about the plates with different technology that's out there nowadays. And I'm assuming that she had balance issues. Did she? And how would you incorporate, or did you incorporate cannabis for that as well?
She had balance issues after her initial concussion.
Okay.
I did not treat her with cannabis at that time. She did well with rehabilitation therapies, conventional. And then after the second, I used those other products for her nighttime issue and her daytime anxiety and headache. But I have seen other concussion patients who have vestibular problems for which I use cannabis therapy. And
with that, is it any 1-to-1 ratio again? Are you looking at type 1, type 2, type 3? What were you looking at?
I either use a type 2 or a type 3 because when it comes to that type of balance disruption, it's a day and night thing. It's 24/7. That type of symptom needs to be treated throughout the day. And so an oral preparation would be more appropriate. And you have to be careful with high THC oral preparations because absorption may be difficult to measure or predict. Everybody's different. In patients who do not have regular cannabis use, oral therapy can be problematic with high THC amounts. The effect can be too intense. So when it comes to oral therapy, for suppressing the vestibular problem, I would go with a 1-to-1 type 2 or a type 3 CBD rich treatment as an oral therapy. That's what I've done in my practice. And I use oral therapy to give a slow and steady response all day long to suppress the vestibular problem.
Gotcha. Well, thank you for that. And thank you for being here. If you want to share your story, we'd love to hear it. If you have any questions for Dr. Stein or myself, please submit your story. Please submit your question. We'll answer them live on air, even get you live on air if you would like to share your story that way. So thank you for being part of this. We'll move on to our next lesson, our last lesson of this module, and we hope to see you there. We look forward to seeing you there. Thank you. What a wonderful look at a very insightful case study. I hope these deep dives on how we explore patient options helps you and your care team in drafting the best options for you. In our next lesson, What Should a Caregiver Know? We will understand the complexities that can be faced when brain injuries are present. With a loving hand and patience, you can make a world of difference for a patient or loved one facing a traumatic brain injury.